Good afternoon, I am Valeria Ferrari. During this webinar, I will show you BTS TMJOINT, the new way of analyzing the dental occlusion. We will see how it works and how to acquire signal in order to evaluate the dental occlusion. Since we care about people's health and we believe that it is possible to change the way to diagnose TMJ disorder, we are proud to present you BTS TMJOINT. It provides a functional evaluation of the dental occlusion and an objective quantified analysis of the neuromuscular balance. With BTS TMJOINT, you can evaluate the occlusal state of the patient in few seconds. How BTS TMJOINT works? It is based on a synchromyographic analysis, and it provides a quick, reliable, and accurate measurement of the occlusal state of the patient. It's totally wireless system, so it doesn't cause any discomfort to the patient and to the doctor, who can continue to work on the subject. Moreover, it's totally non-invasive system. Another important feature is the differential analysis on which is based all the evaluation protocol. This fundamental feature allows us to eliminate all the side factors, like the individual variability, so the anatomical, physiological, and etc. variability, and all the technical variation, like the muscle crosstalk, the electrode position, the conductance of the skin, and so on. How can we do it? Every time we place the probes, we do a first set of tests using cotton in order to avoid the teeth contact. All the other tests will be carried out allowing the natural intercruspation of the teeth, and they will be compared with the setup test. Proceeding this way, we are sure to consider only the variation between the two tests. So we normalize all the resulting indexes, making them comparable from session to session. This is the great idea that makes us different from the other and makes all the previous EMG system and meter obsolete. For all these reasons, TMJOINT is accurate, reliable, and repeatable. BTS TMJOINT has 3 evaluation levels of analysis, and all the protocols and the indexes are already validated and published in the scientific literature. The first level of analysis provides the evaluation of the occlusal state, and it requires the measurement of the electrical activity of the levator muscle, so the temporalis anterior and the masseter. It requires 2 trials in maximum voluntary contraction, lasting both 5 seconds, one using cotton roll and one without cotton roll. The second level is the mastication protocol. Analyzing again the same muscle, it provides an analysis of the neuromuscular coordination during chewing tasks. It requires 2 tests, lasting both 15 seconds, using a chewing gum. The third level integrates the first one, so the POC4, the 4-channel evaluation protocol, with also the analysis of the sternocleidomastoid muscle or of the upper trapezius in order to evaluate the interference of the dental occlusion with the upper chain of the body. It requires 3 trials, the 2 tests like the first level, plus a head rotation test or a shoulder evaluation test, depending on if you're analyzing the anterior or posterior cervical lobe. Dental Contact Analyzer is the software dedicated to BTS TMJOINT. During this webinar, I will show you the new interface of the latest release of the software. As you can see in the main screen, there is the sensor area containing the information related to the 4 and the 6 probes. Here you can see the identification label in order to remind which specific probe is linked to the muscle acquired. You can check the battery status of each probe. Remember that all the probes must be charged in order to do the acquisition. The red status bar means the probes are not active. Turning on the probes will be connected with the receiver, and the status bar will be green. You can acquire only if all the probes are active. In the device section, you can set the radio frequency channel, and you can see also the component sign. Clicking on the setting, you can set the visualization properties of the EMG signal, like the text font, the color and the width of the signal, and so on. In this section, you can also change the language of the software. In the patient list below, you can manage and view all the patient inserted in the database. If you are looking for a specific patient, it is also possible to choose the search criterion to use. You can search for last name, internal code, date of the analysis, pathology defined during the analysis, or also analysis protocol used. All the patient will be listed open in the Dropbox. In the section below, it is possible to see the preview data of the patient selected. Or if you're selected a specific session or trial, in this area you can see the preview data of the session or of the trial. Let's see how to practically use the system in 5 simple steps. Okay, first of all, insert the USB receiver in the assigned USB port. Launch the dental contact analyzer. Turn on all the probes. To activate all the probes, swipe them on the gray area with the shape of the USB receiver, like in the slide. You can see in the slide. The probes will be active in few seconds. Once all the probes are linked to the receiver, start the acquisition. Remember to follow the workflow, so create a patient, add the session, and then acquire the trials. If a patient is already inserted in the database, search the patient and then add a new session and then acquire the trials. Okay, so it's time to practice. We are ready to see a practical session. I already inserted the USB receiver in the USB port assigned. So the second step is to open the dental contact analyzer. I open the dental contact analyzer. Okay. As I told you, I turn on all the probes. You can see it with that the probes now are blinking. So it means they are searching for the USB receiver. What you have to do now is put the pre-gel on the clip. Okay. And now we're going to position the probe on the muscle of the patient. Okay. So, in order to position the probes, remember that the probe number 1 has to be placed on her right temporalis. So, stay back to the patient and touch her right temporalis. Okay. In order to do this, I put my entire hand on her temporalis and ask the patient to clench. Clench, please. Relax. Clench. Okay. Once you feel the body of the muscle contract, put the probe in the parallel direction of the fiber and gently push the probe on her face. The probe number 2 has to be placed on her left temporalis anterior. So again, we put the hand on her left temporalis and that's to clench the teeth. Relax, clench. Okay. Remember to stay back to the patient. The probe number 3 has to be placed on her right masseter. So, touching the jaw angle, you can ask the patient to clench the teeth, and you can feel the body of the muscle. So in this case, do not put the probe on the angle of the jaw, but about 1 centimeter and a half far from the angle. Always in the parallel direction of the fiber. And the probe number 4 has to be placed on her left masseter. And gently push the probe on the face of the patient. Okay. Now we're going to create a new patient. As I told you, we have to respect the workflow. So create a patient, create a session, and then acquire the trials. Okay. Once you insert all the data of the patient, you have to create a new session. So again, select the patient, create a new session. Okay. In this area, you can insert the pathology as you want, depending on your need, and save the session. Now we are ready to acquire. So, selecting the session, we add a new trial. In this case, I placed 4 probes, so I'm going to do a 4-channel evaluation test. First of all, we have to do the setup test, so the cut 4 test. Okay. Just be sure to see. Okay. I'm just making bigger the scale, okay. But now I have to show you how to put the cotton roll. So, in order to do the setup test, we have to take 2 cotton rolls, and to place them on the 5th and the 6th teeth. So the molar and the premolar. Okay. Are your teeth are not in contact? Okay. Stay here. Okay. The important thing is that her teeth, the teeth of the patient, they don't have to be in contact. So the cotton roll are placed in order to avoid the teeth contact. Okay. Okay, now we are ready for side acquisition, the cotton form. Ask the patient to ask the teeth, clench, sorry, okay, relax. Okay, now we're ready. Start clenching for 5 seconds, okay. I'm starting the acquisition and then it will be stopped, automatically stopped, and then I have to save the trial. Okay. I come back with this. Okay, now I have to ask the patient to give me the cotton roll because now the cotton roll test is finished. So we're ready to add a new trial, the clenching trial. Okay, so we do the same test. So we ask the patient to clench the teeth, in this case without cotton roll. Relax. Okay, start clenching please. Okay, we start the acquisition. And the software automatically stops after 5 seconds. Thank you. Okay, so after 5 seconds for each trial, we're ready to evaluate her occlusion state. Just double click on each trial, so a cotton test, a clenching test, and click on the button report. Okay. So, as you can see, we quickly see the results obtained in this test, and as you can see, there are 2 targets. The blue one is related to the temporalis anterior activity. The red one is related to the masseter activity. The gray stripes represent the normative band. So, in the crossing of these stripes, the occlusal state is quite perfect. In this case, as you can see, we have a prevalence of the right side because all the two targets are shift on the right side. About the masseter, she is still in the normal range. About the temporalis, she is a little bit out of the range of normality. The arrow means that there's a torsional attitude, so it means that there's a jaw displacement of the jaw, in this case on the right side. For the meaning of the temporalis of the POC is an evaluation of the prevalence between each couple of homologous muscle. So, about the temporalis anterior, the POC is related to the prevalence between the right temporalis and the left temporalis. About the masseter, so there's you evaluate the prevalence between the right masseter and the left masseter. The barycenter evaluate the barycenter position of the occlusal state. In this case, you can see that the barycenter is the position of the two targets compared to the horizontal line. So, in this case, we have an anterior barycenter. And the torsion is, of course, as I told you, the lateral displacement of the jaw. This is the first page of the report. In the second tab, you can see this green bar. That they means that the meaning of this bar is that is the intensity of electrical contraction. So the green full bar is assigned to the muscle with the highest electrical activity, electrical intensity of contraction, and all the other bars are related to the highest one. In this tab, you can, of course, evaluate different indexes that are not listed in the first page. In particular, it's important to see the impact value, that is the work produced during the clenching. In the POC tab, you can see the cake diagrams related to the cotton test, the clenching test, and the last cake diagram is related to the normalization between the clenching and the cotton test. So the real occlusal state is represented in this cake diagram. The histogram tab is reporting the histogram of each index, evaluated during the analysis. So it represents the index value during the pre-central second of the trial. The info tab is related to the information that you can insert in the report, and you can print in the report that you can print to give to the patient. And the option tab is only the tab related to the option. Okay, so for the reading of the report, there's also another webinar, and you can see it on our YouTube channel. Its name is Guide to the Reading of BTS TMJOINT Report. For now, my aim is to show you how to acquire, how to turn on the system and all the probes, and the steps that the 5 simple steps that you have to do with the new interface. Thank you again. Have a nice day. Bye bye.